Good morning, doctor. How are you today?
I'm great. How are you?
I'm doing wonderful. You're here to explain ITP, which is a really important topic. So I'm going to get started with the questions. Can you tell us more about this rare blood disease and what are the typical symptoms?
Yes, absolutely. So thank you so much for having me. And it's an honor to be partnering with Novartis to bring awareness to this rare disease. We're talking about ITP, which is immune thrombocytopenia. It is a rare disease. It affects about 10 in 100,000 people in America. And I think that it is important to talk about rare diseases because if you're the patient living with it, it's not rare to you. You have it, and you're living with it 100% of the time. So more knowledge and awareness really can only be helpful.
Of course, it's rare. So how is ITP diagnosed?
Yeah. So ITP is a disease, it's a bleeding disease, autoimmune in nature. So what happens is the body mistakenly attacks our own platelets. Platelets are the particles in our blood that circulate and help to form a blood clot if we get cut or injured. So in this disease, patients have low platelet counts, and that increases the risk of bleeding. And the bleeding can be mild. It can be nosebleeds or bleeding when you brush your teeth, or it can be easy bruising or burst capillaries on the skin causing little red dots. Or it can really be serious bleeding that can happen at very low platelet counts where you can have terrible internal bleeding without warning for no reason at all. It is diagnosed by that platelet count. So patients can present with symptoms, the symptoms of bleeding or easy bruising, or sometimes patients don't have any symptoms at all. And the low platelet count on a routine blood test can clue us in that something might be going on. There are many reasons for bleeding, bruising, and low platelets. So once this is found, it is important to then go see a specialist who will do more tests to really diagnose what's going on.
Of course, once you're diagnosed, treatment must be really important. So what is the goal of treatment for ITP patients?
Yeah, you're absolutely right. Treatment is really important to treat active bleeding if someone is bleeding. But even if someone isn't bleeding, there's this risk of serious bleeding at any time. So the goal of treatment is to increase the platelet count to a safe and healthy range so that the risk of serious bleeding is really the lowest possible and hopefully none at all. So we can achieve that with treatment. But I think that more important than getting the platelet count to a right number is really to alleviate the worry and concern that patients with this disease live with, constantly worrying that something terrible is going to happen without warning at any time. I have a patient who's a school teacher, and she teaches young kids. And she was worried to do art projects with the children because she thought that if she got a paper cut, that she would have to go to the hospital. So we made the diagnosis, and of course, with any disease, you should discuss all of the risks and benefits of all the treatment options. We got her on effective therapy, and now she's teaching the class, and she has much less worry.
I'm glad she's doing well, and of course, we want others to do well. So where can people get more information about this?
Yeah. Thank you for asking. So I think that there are really two great websites. One is pdsa.org, and another is myitplife.com.
Well, thank you, doctor, so much for sharing this important information with me today.
Thank you so much for having me. I appreciate it.